Welcome everybody to the third in the series of WebExes, which has been produced and supported by Healthcare Improvement Scotland, but delivered by Buurtzorg, Britain and Ireland. And we're very lucky and thankful to have Brendan Martin, who's the Chief Executive from Buurtzorg, Britain and Ireland, on the call with us, and Margriet van den Heuvel, who's a Buurtzorg coach. But not only the Buurtzorg coach has at least 5 years experience as a Buurtzorg nurse and much more experience in the care home sector or providing what we would call social care in Scotland. So you could see the contact Twitter details if you want to get in contact with them later, and also the neighbourhood care programmes Twitter details too. But that's enough from me. It was just really as a formal introduction and to say how very thankful we are for you both to give up your time today. It is a series of WebExes. This is number 3, as you see here. We had Magdalene in webinar 2. If you want to access to the recording of these, please again drop us a line to this email address. And please feel free to forward any diary invites to any colleagues or anybody that you think is applicable to receive them. We'd just be happy if those invites were free shared to get as many people to the WebExes as possible. So thank you both. The ball is in your court, but I'll forward the slides for you. Brendan and Margriet, you should be seeing slide number 1.
I can see them, yeah.
And Brendan?
Yes, I can see it too.
Super. Well, once again, thank you very much, and over to you.
Hey, good morning, whatever time it is. Hello, everybody, and it's glad to be here again with the third of this series of webinars. I'm very glad to be with my colleague and friend, Margriet. How are you, Margriet?
I'm very well, thank you.
Good. And where are you today?
I'm in Holland at my own little fancy office at home.
Okay, and that means you're in a beautiful little town called Buurtzorg.
That's correct, yeah.
Which is close, not too far from the area in which you support 45 or so Buurtzorg teams in the Amsterdam area. Is that about right? Yeah,
that's quite right. I support 40 teams in the region of Amsterdam, and Amsterdam is about 40 to 45 minutes drive from where I live. Yeah.
And what we're going to talk about today, Alec, would you move on to the next one, please? Is first of all how a team starts in a Buurtzorg team, because here in Britain, as you know, Margriet, from the work you've done with us in various parts of England and Scotland, we've been working with health and social care organisations who sometimes have asked an existing team to start to work in a Buurtzorg way. In other times have recruited new teams. But I thought it might be a good place to start, since today we're talking about how a self-managed team in Buurtzorg works, to begin by talking about, well, how does a new team start in Buurtzorg?
Well, within Buurtzorg, there's two ways to start a new Buurtzorg team. And the first one is that a group of nurses takes the initiative to start a team, and they take contact with the back office in Almelo. And as you can imagine, they've heard from Buurtzorg all over Holland. And this is the way how the most of the teams in Holland started, but that's years ago. For the most teams, it's an average of 7 to 10 years ago. And a little group of nurses starts and hears of Buurtzorg and makes contact with the back office and says, well, we want to start a Buurtzorg team. Is that possible? And then the coach comes in, and we meet, and we get to know each other, and so on. This is one possibility, and but it always starts with nurses. It's not a manager or someone who says, well, we want to have a Buurtzorg team in this area, it starts, the nurses are always the start. The other way to create or to start a new team is that an existing team splits up because, for example, it gets too big or there are too much clients, and then an existing team can decide by themselves to split up and to form another team, for example, in the same area or maybe in another area.
So that means that when a team starts or when a team divides, at that stage the team might have what, maybe 4, 5, 6 members of the team. Would that be right? And then,
yeah.
And how does it then expand from there on?
Yeah, a team, we advise that a team can start from 5 to 6 team members. Because when you have a team that is much smaller, a team is very vulnerable, and yeah, that's not a really healthy start. Sometimes a team starts with 4 or 5 nurses, but then our advice is to expand in a really short time to create some more flesh on the bones and to be less vulnerable. From that point, they can recruit their own new colleagues, and more important, of course, they can find their own new patients. They have to make contact with doctors, with GPs, with physiotherapists, with occupational therapists, and so on. And they're going to create their own network in the neighborhood and to take care that they are seen and getting to know everybody in the neighborhood, and then they can take care for their own clients, and that's how they expand on a natural way. When there are more clients, they can decide to recruit new team members.
So if a team, thank you, Margreet, and if when a team does divide and therefore might need a new office, how do they go about finding an office, and what kind of office space do they use as their base, as their headquarters for the team itself?
For the team itself, yeah, it varies very much. A team is responsible to find their own office. So they can find in the area where they work, they can find their own place by connecting with the network or whatever. Some teams find an office in next to a GP, for example. I have teams who have an office as part of an office in a church. Some teams have an office in an old shop, for example. So it varies very much. And a team is responsible to find their own office and to make contact and so on. But the contract and the negotiation about the contract is done by the head office, the back office in Almelo.
So the team decides where it wants the office,
yeah,
and so on, but it doesn't have to deal with all the administrative paperwork with it. It passes that to the back office in Almelo.
That's the back office, yeah. But the team decides where the office is. Yeah.
And in fact, the picture you can see on your screen now is a picture of one of the Buurtzorg offices in Wijk bij Duurstede, which is the small town where Margreet lives. And the people you see in that, one of them is a member of a team. That's the woman on the right, Nanda. The rest of the people in that picture are, in fact, from Suffolk, taking part in a study visit. But I wanted to be able to show you the kind of space that some Buurtzorg teams have for their office. And finally, with this slide, Margreet, you mentioned that teams themselves decide when to divide. But I think I'm right in thinking that if they get to 12 members of the team, they have to divide. That's one of the very few rules in Buurtzorg, as I understand it. Is that correct? And if it is, can you explain why that number of 12 is significant?
It's not quite a rule. It's not an obligation to split up when a team becomes bigger than 12, but it's more an advice. And we think, and we see it in practice, of course, that when a team becomes bigger than 12, then it's hard to make decisions in consensus. It's hard to stay focused on your vision. Meetings get more complicated. It's more complicated to collaborate when you're bigger and bigger. So it's our advice that the team is not bigger than 12. And in practice, when a team becomes big, or they decide to stay with the 12 and not to grow anymore, or they decide to split up, of course. But I know one team who is with 13, 14 team members, and they really don't want to split up. That's an exception, but there's no obligation.
Okay, so even where there is a fairly strong guideline, it's interesting to hear that the Buurtzorg culture is, well, you know, that's a guideline, but it's not a cast iron rule, and that sort of represents the balance between the way in which Buurtzorg offers and shares knowledge about what tends to work best, but at the same time without telling teams exactly how they ought to do their work.
Yeah, that's exactly true. Yeah.
Thanks, Margreet. Alec, could we move on to the next slide, please? And here's another Buurtzorg office. I can't quite remember where this one was. But
I don't know it either.
No. But again, this time you're seeing, again, not a Buurtzorg team, but representatives of NHS workers from the northwest of England who like in the ones I showed you from Suffolk, are working to move towards the Buurtzorg way of operating. And what I'd like to talk about now, Margreet, is often when people hear about Buurtzorg working through self-organized teams, and you've just given an example with a guideline about the size 12, but it's still not being an absolute cast iron directive. That doesn't mean, though, does it, that teams simply make it up all as they go along. As a whole organization, Buurtzorg has a vision and a mission, and teams operate within a framework which is in compliance with that vision and mission. Could you explain what the framework is and what it's for in Buurtzorg?
Well, the framework within Buurtzorg is not really explicit. It's actually it's built in the whole system, and it's built in the whole way we work. But the framework it's the basic rules, and it creates the space within a team can decide by themselves. For example, the framework within Buurtzorg is that teams have to reach a productivity rate from 61%. Another part of the framework within Buurtzorg is that teams are on call 24 hours a day. They're available 24 hours a day. Not everybody, of course, but the team needs to be on call. Another part of the framework is that there is no hierarchy. They have to work in a self-managed team. There's no team there that they can't say, well, you're the team leader or something like that. They're all those things are part of the framework, and the framework I think it's best to describe that it's the basic rules, and within these rules, the teams can make their own decisions And it gives clarity about what kind of decisions teams can make and what kind of issues they can discuss, whether or not. Yeah.
Thank you. It's worth remembering, I think, that you mentioned that the framework in Buurtzorg is not explicit, but it's also in that context, I think, important to remember that Buurtzorg started up, as we've seen in previous webinars, 12 years ago with one team, and it's now grown to 950 or so teams.
Yeah.
And so the culture and the cultural norms in Buurtzorg have grown up with that expansion, whereas I know that where Buurtzorg has supported other organizations to change from within in the Netherlands, they found it useful, at least for the first few years, to have a more explicit framework.
Yeah.
And we found that in Britain. Can you tell us anything you know about that?
Yeah, I think in teams and organizations who are starting from within to change to self-managing teams, I think the framework is really important. And I think the framework is one of the first things to create when you're going to start with self-managing teams. Because the framework then gives the clarity about what kind of decisions teams can make and how much space they have to make their own decisions. So, yeah, instead of Buurtzorg, where the framework is part of the way we work and built in the way we work, I think when an organization or a team starts, from within, one of the first things to create and to discuss is the framework. Yeah.
And we're going to be looking in more detail at the framework in webinar number 4 of this series. So let's park that one now and move on. Alec, the next slide, please. Here's another team from Britain that this time pictured in The Hague, in one of the Buurtzorg offices in The Hague, where we took that team from London for some of their early learning and development support. One of the other aspects of Buurtzorg teams is that they manage everything about the service themselves, which means that they, as you said, they find their own office, they decorate their own office the way they want it, they furnish it for going out and getting the furniture they need, and so on. But they also divide up some team tasks. Can you tell us about those tasks and why they're important?
Well, the team together is responsible for the team result. They're together responsible for the result in terms of client care, but also in terms of quality, in terms of financial issues. So they have a joint responsibility, and this responsibility, in practice, the teams, all the tasks that has to do with the client care and with the organization of the client care takes place in the team. And within the team, these tasks within Buurtzorg, we turn them into roles. And within the teams, the roles are divided. Every team member has a certain role. And by doing these roles, everybody has a responsibility in making the team work, and in the organization of the team and the organization of the client care. So it has to do with, for example, the team is responsible for their own recruitment, like I said before, but also for the planning, for the rota, for the office, for mentoring other colleagues, for coaching other colleagues, the sick leave, all those issues are a responsibility of the team. Yeah.
And do each of those roles get allocated to the same person who keeps them, or I've come across teams, in fact, most of the teams I've met in Buurtzorg in the Netherlands rotate those roles. Do you think it's important to do that?
Yeah, that's my advice, or it's a little bit between an advice and a framework, because we think it's very important to rotate those roles, because when you rotate them, for example, every 3 or 4 months, then that keeps a team vital, that keeps the team healthy, it keeps the relationships between the team members healthy, because when you can imagine that there are some team tasks or roles which have some more, you have more to say about your team members, or you have more to say about the going concern in a team. When you some team task implicates a kind of hierarchy, and to avoid this hierarchy in a team, because you don't want hierarchy in a self-managed team, it's really important that those roles and tasks are rotated. Yeah.
You say that you don't want hierarchy in the team, however, there are in the teams, aren't there, as I understand it, 3 different levels of qualification. There's the bachelor nurses, the registered nurses, and nurse assistants. So in terms of qualification, there is a certain hierarchy, and of course that's reflected in pay levels too. But but nevertheless, despite that, within the teams, each member of the team is equal in terms of their of being an equal member of the team. Is that right? So how do you avoid? How do you manage that relationship between some members of the team being paid more than others and perhaps being better qualified than others, and yet not having a hierarchy in other respects?
Yeah, I think there are 2 ways. On the one hand, there are 3 levels of nurses, and that's just the way it is. And some they complement to each other, and the other, and that's just how it works within the Netherlands with those 3 levels of nurses. And the other way is that although you're another level of nurse, you're not a bachelor nurse, but you're a nurse assistant, for example, you have the joint responsibility for the team results. So that's the same. It's more in the client care that in the client care that the differences between the levels are seen, and in the whole organization of the team, everybody can be a planner. Every level of nurse can be a mentor, for example. There's not a difference.
Thanks for explaining that. Even though there are some of the team members who are qualified differently from others, am I right in thinking that they all work as generalists, even if some of them might have had specialist training? And what's the significance of, and if I am right about that, what's the significance of them working as generalists? Yeah,
within Buurtzorg we say everybody is, with every nurse is a generalist, so we can take for all kind of types of clients. Although some nurses have a specialist in palliative care, for example, or wound care, but they're all complement to each other. And as a team, you're responsible to take care for all type of all kind of types clients. So the team has their own educational budget as well. So at the start of the year, a team can decide and say, well, we see we have a lack of knowledge in diabetic care, for example. So as a team, we're going to decide who is going to learn more about diabetic care, to keep the joint knowledge about all kinds of clients vital and good.
Thank you very much. Alec, could you move, I'm aware that we're running up against time. Alec, next slide, please. When it comes to how the teams manage their affairs, then, Marit, teams must have meetings. How often do they meet? And what do they talk about when they meet?
Teams can decide by themselves how often they meet. In practice, a team meets for an average once in the 2 weeks. And during this meeting, as a coach, I train them in solution-focused meetings. And in these meetings, they make decisions in consensus about all the daily affairs, about team issues, about contracts of colleagues, about the way they work. They discuss all the issues about the way of working, and they make agreements. They make decisions in consensus, like I said.
When you say consensus, does that mean that everybody in the team has to think, oh, this is the greatest idea I've ever heard, otherwise they don't agree it? What do you mean by consensus?
Consensus means that everybody has to agree. And like you always say, Brandon, is you don't have to be over the moon with a decision, but just saying, okay, I agree, I can live with it, it's okay.
Often I've come across, and I think that's really important, because I know that there are many organizations in Britain that are committed to the principle of consensus, but find that they talk about stuff for a long, long time and never really make any decisions and get on with action. Whereas what I love about the Buurtzorg approach to consensus is, well, yeah, I can live with this, and let's give it a try for, let's say, a month. I'm not absolutely sure that this is going to work, but I haven't got a better idea either, so let's give it a try for a month and we'll evaluate it after a month. And so that way you can combine a consensual approach to decision-making in the team with an action-orientated approach as well. Have I got that right?
Yeah, that's true. The whole process of making a decision is really important. And as teams, as a coach, I stimulate and advise and train the teams in making decisions and also making agreements. So that's really a very important process in working with the Buurtzorg way.
Okay, thank you. Alec, next slide, please. And one of the questions we get asked most frequently, Marit, is with the Buurtzorg teams are working all the time with highly vulnerable people in situations where there can be literally life and death outcomes of the decisions that they make in conjunction with their clients. So quality and safeguarding of the rights and interests of clients is clearly very important. Some people worry that without a manager and without a hierarchy, that won't happen. What's your experience about quality assurance and feedback in a team?
Well, I think quality assurance and feedback are two different things. And quality assurance, we assume as Buurtzorg that every professional, every nurse wants to deliver good care. And that has to do with trust as well. We highly trust the nurses in their profession. And we know and we see that every nurse wants to deliver good care. So that's the base of our vision as well on quality assurance. The other thing is that working in a team and being aware that you as a team you have a joint responsibility for the result. The team members are responsible for the quality assurance of their own, but also of their colleagues. So they discuss this in the team meetings. Another thing is that the communication lines between the client and the nurse are really very short. So, and that's also a part of the vision of working with Buurtzorg, is that there's everything has to do with a good relationship between team members, but also the relationship between the clients and the nurses. So within this relationship, we see that when there are complaints or when there are issues between a certain nurse and a client, the client will discuss this with the nurse, and it will become an issue in the team meeting, and they find solutions for it. Another thing is that the web and the whole system of the web within Buurtzorg, we have also questionnaires for client satisfaction. So teams can monitor the client satisfaction every now and then and discuss this within the team and see what can be done better. Yeah, and teams can organize yearly interviews not with the clients, but with the colleagues. And within this interview, they can give feedback to each other, and they can discuss their own performance. So that's how we do this. Okay.
Margreet, as ever when I speak with you, you stimulate lots of questions, and I know that there are some amongst the people who've been listening. My apologies to everybody that we've run a little late, but Margreet and I are both here to happy to carry on. So, Alec, next slide, please. And if we don't get to your questions today, of course, we'll be more than happy to take them later. There's really what we've done in this webinar so far is scratch the surface. But let's move on now to some of the questions that are coming up from the participants. Alec, could you let us know what some of those questions are?
Sure. Thank you very much, Brendan, and thanks, Margreet. I hope I've said your name this time right. I realise I haven't said it correctly the first time. I'll open up the lines now. If there's anybody with any questions, please do jump in, because I've got a couple myself. But in the interest of time, if you have to get back to work, is there any questions on the lines just now? Okay, I'll take the opportunity then. So thank you very much, both. And one of the questions, and I'm glad that there's in the next series or webinar number 4, and we'll go into more detail about the framework. But I'm conscious and aware that, especially in Scotland, we have healthcare and social care, and the challenge for us is how to integrate those services and how healthcare providers and social care providers work together. I assume that different teams have different frameworks, and if so, is there kind of a standard template that's sent to teams to begin with as a starter for 10? And if there is, do those templates cover things like clinical governance and who's responsible for which, or responsible and accountable for different decision making?
You want me to answer this question?
So yeah, so I suppose to summarise, there's 2 parts. Is there kind of a standard template that people are sent to start them off? Because I take it that people have different frameworks and different teams. And also, does it cover clinical governance, as in who's responsible and accountable for what tasks? And because that's one of the challenges that we actually experience in Scotland is to decide who's responsible for who, especially when it comes to perhaps social care providers providing more healthcare-related tasks and healthcare providers providing more social care-related, tasks. So, does it define who's responsible for who, for what?
You said I don't know if I understand you well, but you said that different teams have different frameworks. Within Buurtzorg, there's one framework for every team. The framework for all the teams is the same. Framework is an organizational issue, and it's not it doesn't vary per team. It's just one framework per organization, and it's for all the teams within that organization. The framework, well, what we have within Buurtzorg is we also have the governmental issues, and we also have, I don't know the right words, but we have, Brendan, I don't know if you know the right words, but within Buurtzorg and within Holland, we also have issues from governmental
some regulations, I think you're talking
regulations,
about.
Yes, exactly.
Yes,
and within the back office, that's a role of the back office to make these regulations as simple as possible for the teams to translate these regulations within a workable into a workable framework for the teams.
Yeah, that's one of the most important roles, I think, of the services behind, the services in the back office.
Yeah.
Is to, I mean, of course, as in Britain, there is regulatory compliance to be taken into account. There's the law. Some of these regulations one might like better than others, but they have to be complied with anyway. And part of the role of the back office is to think, well, okay, we want the nurses to be thinking about how they provide care and how they operate as a team to provide the best possible care and create the best possible well-being for their clients and for their neighborhoods. What we don't want them to worry about is lots of other administrative detail. So we're going to make it as simple as we can for them to get on with their jobs in a way that also complies with regulation. And the Buurtzorg back office sees that as very much part of its role to support the teams in that way, and they're very good at it.
Thank you both. And there's been, I'll have two more if you're okay to stay for two questions sent privately. Is one from Ashley Spalding from Stirling and Clackmannanshire that says, how do Buurtzorg teams record the decisions they make for the service improvement, and how do they monitor the impact that the decisions that they've made? So how do they keep a record, first of all, about the when they meet to discuss, and how do they monitor the impact of it?
You mean how do they record the decisions they made within their team meeting?
Yeah, that's what I mean. How do they record the decisions that they make regarding improvements? If there's something that they've decided to try out, how do they record that, and how do they monitor the impact it has on the service they're delivering?
They're doing this that's part of the team meeting as well. And as a coach, I advise the teams to make notes, of course, of the team meetings, but only to write down the decisions. And then you have a really clear way of working when you only write down the decisions. And you make agreements about when you want to evaluate these decisions. So that's how a team does this. But some teams don't have a really strict way of working in this. A team is free to choose their own way of work, but as a coach, I can advise some. I can advise them in the way to work with this. Yeah.
Okay. What have you found works well in that respect, Margreet, from your own experience with 40 teams that you support? Have you been able to see when a team is making some decisions like Ashley is referring to, and the idea is to put those decisions into practice and to learn from them and perhaps tweak the practice from time to time as a result? What tends to work well there, or are there lots of different ways of doing it?
Well, it tends to work well to make, at first, I advise teams to make a team contract. And within this team contract, they can write down some basic rules about how to communicate with each other, how to organize the team meetings, how to deal with team decisions, how to deal with consensus, and how to deal, for example, with team members who are not in the team meeting, who are not able to join the team meeting because of sickness or leave, something like that. And I stimulate teams to make decisions or agreements about all these issues, just as a basic, as a team contract, because this team contract, it creates the common ground for the team members to function, and that works very well. That's at the base, and from that point, they can make the team decisions in the team meeting and to write down these decisions. And to evaluate them every now and then.
That's very clear. Ashley, does that answer your question?
Yeah, it does. No, that's really good. Thank you.
Okay. Alec, any more?
There is one more. Again, I'm conscious of time, but do you both have, or Margaret, do you have time to answer one last question?
Yeah.
Oh,
Margaret, are you okay for another 5 minutes, Margaret?
Yeah, okay, yeah.
Yeah, me too.
So thank you. And as a final question, I think it leads on to your experience as a Buurtzorg coach, because I think one of the things in the neighbourhood care teams that we're actually finding is that it's such a viable position and a viable role within teams, and teams either have just started recruiting for coaches, or have maybe had them for maybe about 3 or 4, maybe up to 6 months. Some meeting virtually over video conference because of the geography of Scotland. But I suppose it asks, what's the most common theme or topic that you find yourself coaching teams through? Is there a certain regular theme or regular issue or challenge that Buurtzorg teams commonly deal with?
No, there's not a really one issue that's common for all the teams. All the teams, they are in different phases, and some teams ask my help in how they, for example, in how they have to organize the team meeting. Some teams have conflicts, and they need some help to deal with this conflict. I think another important role of the coach is providing training in the way of working on a in a self-managed team. So it varies a lot. Sometimes are just practical questions. But most of the questions I think, doing with team dynamics. They have to do with the team dynamics and how to deal with conflicts, or how to deal with feedback, giving feedback to each other. How do I do that without having a conflict, or without or with keeping the relationship good and healthy between the team members. And teams in Holland, and I think in Scotland and UK is the same, we have a lack of nurses. So very much teams, they are really very busy and over-asked, and it's an issue to keep the teams and keep the nurses vital, and teams want some help in that as well. Yeah.
Thank you.
Well, speaking of that, we have the webinar number 5 in March will focus in particular on the role of the team coach, and perhaps Margreet, we can ask you back to go into more detail about that at that time. But now I'll hand back over to Alec. And Margreet, thank you very, very much for your input, and I'll hand back to Alec now.
Yes, thank you both, and very comforting to know, Margaret, that it's very universal and similar issues that all teams, I suppose, must be finding as well, regardless of nationality. But yes, just thank you for staying on the line. If you've stayed on, thank you for your extra time, Margaret and Brendan, and thank you for the great presentation. This is a series, as we said. The rest of the series, 4, 5 and 6, we've alluded to through the chat today. Please drop us a line at the email address there, or feel free to share the diary invite with the rest of your teams. Thank you very much both, and we'll just stop it there because I'm conscious of time. But again, thank you so much for your time and such an interesting topic, and thank